You know, in the world of medical technology, a brilliant innovation is really only half a battle. Today, we're diving deep into a high-stakes corporate drama between two companies, IceCure Medical and Sensus Healthcare. Using a fantastic analysis from HDIN research, plus their official 2025 financial filings, we're going to uncover how a breakthrough technology can get completely stalled by bureaucracy and how an established market leader can be brought to its knees by a single policy proposal. This question right here, it isn't just academic. It is the engine driving a multi-billion-dollar shift in healthcare. We're talking about moving away from the scalpel and into a new era of minimally invasive treatments. These are technologies that promise not just to save lives, but to do it with less pain, a faster recovery, and just all-around better outcomes for patients. And that brings us to our two case studies for today. IceCure Medical, they're the innovator with a really disruptive freezing technology, and Sensus Healthcare, the established incumbent. We're going to put both of them under the microscope, and we're going to focus specifically on the pivotal year of 2025 to see how their very different strategies and technologies collided with the harsh realities of the market. Okay, let's get into it. All right, here's our game plan. First, we'll set the stage by exploring this new medical frontier they're operating in. Then we'll properly introduce the companies and their core technologies. After that, and this is key, we'll dive into the real battleground, that maze of regulatory approvals and insurance payments. Then we'll follow the money, analyzing their 2025 financials, and finally, we'll zoom out to see what this all tells us about the future of medtech. So the mission here is elegantly simple, even if the science behind it is incredibly complex. Destroy tumors with absolute precision, causing as little damage as possible to the healthy tissue around them. It's a huge shift from invasive surgery to targeted energy, all focused on improving everything from recovery time to the patient's overall experience. Now, let's meet our two contenders. On one side, you've got the innovator, pushing a brand new application of its technology, and on the other, an established incumbent, really just defending its turf. On the left, you're looking at IceCure Medical's ProSense system. That's the challenger's tool. And on the right, you have Sensus Healthcare's core offering, superficial radiation therapy, or SRT. Now, these two devices, they represent fundamentally different philosophies for tackling the very same problem. Okay, so here's the crucial point. Their core mechanics are polar opposites. IceCure's whole approach is to literally freeze the tumor solid, a process called cryoablation. Sensus, on the other hand, uses these targeted, low-energy X-rays to destroy cancer cells from the outside. So it's freeze versus radiate. Let's zoom in on what IceCure is doing. A physician guides this thin probe using ultrasound right to the tumor. Then they circulate liquid nitrogen inside it, which forms a super precise ice ball that just engulfs the tumor. This extreme cold crystallizes and destroys the tissue, offering a surgical alternative for organs like the breast, kidneys, and lungs. Pretty incredible stuff. Now let's talk about Sensus. Their SRT has been the go-to technology for dermatologists for years. It's a non-surgical option for skin cancers, especially in really sensitive areas like on your face. They've built a very strong business around this, and they've treated nearly 1 million patients all over the world. And this brings us to the true battleground, where the tech meets policy. Because in the medical device industry, having a brilliant invention, well, it's just not enough. You have to navigate this brutal maze of government approvals, and maybe most importantly, convince insurance companies to actually pay for it. This timeline right here perfectly illustrates IceCure's challenge. It shows this multi-year, high-stakes journey just to get its innovative breast cancer treatment approved for a very specific group of patients in a huge U.S. market. I mean, it was a total roller coaster, from an initial denial to a favorable panel vote, and then finally getting authorization in late 2025. But here's the thing. FDA approval was just one mountain peak. As HDIN research points out, IceCure now enters this critical transition phase. They call it the coding upgrade. So while they can now legally market their device, unlocking widespread commercial success means they have to move from a temporary, less reliable insurance code to a permanent one. And that is an entirely separate and often very lengthy battle. Now, let's pivot to Sensus. While IceCure was fighting tooth and nail for approval, the established incumbent faced a crisis from a completely different direction. They had a stable, profitable business, and then in 2025, this happened. A staggering 34.3% drop in revenue. So what on earth happened? Well, Sensus' established business model was suddenly shaken to its core. And it wasn't by a new competitor. No, it was by a proposed policy change from the Centers for Medicare and Medicaid Services, or CMS. The very foundation of their revenue, those insurance codes, was suddenly up in the air. This quote from the HDIN research analysis, it just says it all. The mere expectation of a change coming in 2026 caused their customers, the dermatology clinics, to slam on the brakes and stop buying new machines in 2025. It just goes to show you the immense risk for a company that is so dependent on one single established reimbursement policy. This whole regulatory battleground has a direct and often dramatic impact on the bottom line. So let's do it. Let's follow the money and compare their 2025 financial performance, pulling the numbers straight from their SEC filings. Wow, this table just lays the financial reality bare. Look at IceCure on the left, revenues of just over $3 million against a $15 million loss for the year. And that massive $120 million accumulated deficit, that represents years of burning cash to develop their tech and fight for market access. Now look at Sensus. They still brought in over $27 million in revenue, but that reimbursement uncertainty was enough to flip them from a historically profitable company to a nearly $8 million loss in a single year. So, after all that, what does it all mean for the future? Let's put this all together and look at the key takeaways for each company and, what their struggles can tell us about the broader medical technology industry. Okay, here's the core challenge for each. For IceCure, the innovator, it is a race against time. Can they survive the high cash burn long enough to get widespread physician adoption and secure those permanent payment codes? For Sensus, the incumbent, that 2025 shock exposed a really critical vulnerability. Their job now is to get back to profitability while urgently diversifying away from their over-reliance on a single revenue stream. Essentially, one has the regulatory green light but is starved for cash, while the other had a cash cow that proved to be dangerously fragile. And before we get to our final thought, just a quick reminder, this explainer is based on an objective strategic analysis from HDIN research as of year-end 2025. It's for informational purposes only, and this is not financial advice. The diverging paths of IceCure and Sensus in 2025 perfectly frame this critical question. One company has a potentially game-changing technology, but is fighting for its financial life. The other had a stable, profitable model that was shattered almost overnight by a bureaucratic change. It really leaves us all to wonder which path will ultimately prove more resilient in the high-stakes world of medical devices.